Hello guys, we are going to read about malignant hypothermia. Okay, it's a very important topic for PG entrance examination. Okay, so malignant hypothermia. Okay, we have to read about it. So malignant hypothermia is a life-threatening condition. It's a life-threatening condition. Okay, it's a very important thing. It's a life-threatening condition. It's a medical emergency. It's a medical emergency, and it is genetically determined. Genetically determined. So it's very important for us, for anesthesiologists, to elicit the history of malignant hypothermia in any of family members or patient himself or herself, if he or she had any episodes of malignant hypothermia before in any of the surgery. Okay, it happens immediately during or immediately after anesthesia, during or after anesthesia, and may be precipitated by potent inhalational agents. What happens in this? What happens in this is the mechanism. What is the mechanism? The mechanism involves sudden rise in intracellular calcium due to release of stored calcium in sarcoplasmic reticulum. So the mechanism seems to be this thing: the sudden rise in intracellular calcium due to release of stored calcium in sarcoplasmic reticulum. This calcium stimulates contraction. Okay, it stimulates contraction, it stimulates rhabdomyolysis, and it stimulates hypermetabolic state. Okay, these all things are stimulated by calcium. Okay, what is the reason for this? Because there is abnormality in ryanodine receptors. Ryanodine receptors. There is mutation in ryanodine receptor. This causes the malignant hypothermia. Okay, what are the drugs causing malignant hypothermia? Drugs causing malignant hypothermia, it's a very important topic. The drugs causing malignant hypothermia is succinylcholine. We write it in short form SCH. Okay, other drugs are halothane, enflurane, isoflurane, sevoflurane, desflurane. These all are the inhalational agents. Desflurane, MAO inhibitors. Okay, these are the drugs causing malignant hypothermia. Which is the most common most common drug implicated in malignant hypothermia is succinylcholine. Succinylcholine is the most common cause malignant hypothermia. Okay, amongst inhalational agents, halothane is the most common cause among inhalational agents. Okay, so if succinylcholine and halothane is used simultaneously, then there is higher incidence of MH. Okay, so what are the clinical features of malignant hypothermia? The masseter spasm is if a patient develops severe masseter spasm after succinylcholine, then there is significant possibility of malignant hypothermia. There is significant possibility of malignant hypothermia. Other features are tachycardia, arrhythmia, hypertension, rise in EtCO2 and tidal CO2. Okay, this may rise more than 100 mmHg. Okay, normal range is 32 to 42. This is very important. Okay, so rise in EtCO2, this is the earliest and most sensitive indicator of MH. Okay, other features are hyperkalemia, metabolic acidosis, elevated creatine phosphokinase, muscle rigidity, okay. There is also increased myoglobin, and this causes renal failure. So what is the test which is used to detect malignant hypothermia? So one test is CHCT, caffeine, the full form is caffeine halothane contracture test. This test, caffeine halothane contracture test, is the gold standard. This is the gold standard for diagnosis of malignant hypothermia. Okay, this is the gold standard test for the diagnosis of malignant hypothermia, but this is available at only few centers in the world, approximately 30 centers in the world. Okay, so this CHCT should be considered for all those who are judged to be significant risk for malignant hyperthermia. How we can elicit the significant risk is either by the family history or by eliciting the signs of the episodes of malignant hyperthermia, if there has been previous uncharacterized adverse events to the general anesthesia. Okay, now what is the management? Immediately, so much stress on immediately stop all anesthetic agents. So after stopping all anesthetic, what we have to do is the second thing, hyperventilation with 100% oxygen. Okay, so and there is hypothermia also, so we have to cool the body by ice cooling, and we have to do the body cavity lavage. We have to stop the cooling when the core temperature reaches 38 degrees centigrade. Okay, we have to correct the acidosis by giving sodium bicarbonate. We have to correct the hyperkalemia. How? By giving D10% with insulin. Okay, we have to maintain urine output. It's very important. Okay, what is the drug of choice? The drug of choice is dantrolene IV. Okay, so dantrolene is the most effective treatment for malignant hyperthermia. Okay, how much it is given? Dantrolene, it is given 2.5 mg per kg body weight. So 2.5 kg per kg body weight, and then it is given as titrated dose according to heart rate, temperature and EtCO2. Okay, this is all about the, and one thing more, arrhythmias. How to treat arrhythmias? Arrhythmias for IV lidocaine is given to treat arrhythmias. One thing more, avoid calcium channel blockers here. Okay, that is all for malignant hyperthermia. Thank you.